last fall, you said?
What, 2 weeks ago?
Yeah, about 2 weeks ago.
Right before.
Like slid on carpet, basically.
No, right here. What were you trying to do? Change your pants or something? He was right here by the bed and didn't fall completely. Kind of caught himself. And I was here.
Fell to your knees, kind of? Is that where the
Did you
knee?
get down to your... No, the knee thing happened when he... That was right before Thanksgiving.
Okay.
When he fell real hard.
Okay.
And fell, I mean, real hard right here. Because he was sitting
And
on
my
the
head
bed,
was against the door.
changing his pants. And hard. It took a long time to get him up. Then we got him back in bed, and then he fell out of bed.
So
he
2
fell
weeks ago
twice.
without injury.
Right. And ended up with some pretty bad bruises.
Do you need me up again?
No, you're good.
I mean, he was bruised real bad on his both sides.
Hips.
And then the knees and elbows. We beat him up pretty
There
good.
you go. I used to race bicycles. Or I should say I used to fall off bicycles.
Those are the 12-ounce cans, right? 16.
Yeah. 12.
And do you put the hemp seed oil on your tongue?
Mm-hmm.
Something.
Was it the 1,000 milligram full spectrum?
Milligram or microgram?
MG. Is that microgram?
Daily? How many?
About once every 3 hours.
1 drop every 3 hours.
Drop 2 droppers every 3 hours.
Okay, 2 droppers every 3 hours. No, that is not illegal at all. My husband uses hemp oil for his back.
Mm.
Huh, so you couldn't help him.
Well, no, I'm all about natural Eastern.
It doesn't take it away, but it takes the edge off.
Yes.
Well, you can take it away. I heard of it.
So what I'm thinking is for you, Cymbalta is a really good medicine. I don't know why they didn't address this, but post-stroke, it's very, very, very common to experience depression.
Mm.
And it's not because of anything that you have done to yourself to cause the depression, but actually your hormones after the stroke.
Oh, he had it before the stroke.
Okay.
Anxiety, severe panic attacks.
Panic disorder.
Restless leg syndrome. Just pain in the leg.
Literally. Panic disorder.
Mm-hmm. Because there was a while he couldn't drive. And that was pre-stroke. And they did give you, what did they give you? Remember we went to Dr. What's her name and she gave you something.
Dr. What's her? Where would that be?
Down by the post office.
They had me on a Paxil or something like
That's
that.
it.
Well, and then I couldn't sleep for 2 nights in a row. So they sent me to this psychiatrist. Or their, what's his name?
Dr. Sharma, but it wasn't Sharma, but it was Behavioral Medicine Center. But they got into it, so Chuck was not a patient of his.
Some people you don't mess well with.
And he still charged.
Seriously?
Yeah. $200. But he didn't do a darn thing.
And that was all pre-stroke.
Because I said to him, you haven't even asked me if I drink coffee or not. And that was a big problem that I had when we moved. I worked at Checking a Cash. So when we moved into the village.
Yeah.
There was a cappuccino maker right
Oh my gosh.
across from my desk.
So you were addicted.
Yes,
But then he quit caffeine and cigarettes at the same time. And I'm still convinced that what led to all your issues.
What was
Because he
it?
cold
Oh,
turkey both of them. I mean,
Nicotine and caffeine.
I'm not kidding. He did it at the same time, and you went crazy after that.
It was crazy before that.
Well, but you went crazier. So I don't recommend that.
Well, if you smoke cigarettes, you have the caffeine stays in your system twice as long.
They're called synergists.
Correct.
I want to start you on Cymbalta, but I'm trying to see how much it is.
What's that? That's the depression thing?
So my mother-in-law takes it, and I love it. And it's an antidepressant, but it also helps with chronic pain, especially back pain, and diabetic neuropathy, which I know you don't have diabetes, but it helps with neuropathic pain, which is nerve pain, which I think you also have.
I was thinking a shot of cortisone on both sides.
It could help, but that's temporary relief.
Darn good. Well, that's all I'm looking for because I gotta do exercises to strengthen. That's the word I'm looking for. Deadlifts and planks and push-ups.
True, we'll get there, but I can't fix you overnight. This is going to be a slow
Oh,
process.
come on.
I know. I want blood work because in order to give you medicines and stuff, I need to see what your kidneys and liver are doing. Have you ever been told you have anemia or anything? Low blood?
No.
Okay.
So you can't help me today?
I'm going to start you on Cymbalta.
Okay.
I want.
Will I be able to rest?
Yeah.
Okay.
It's got to kick in though. You got to be patient. I'll give you a muscle relaxer, but you cannot. So this is what's going to happen. This is what I want to happen. I'm not going to tell you what you're going to do. I'm going to ask if you want to do this.
I'm going to do what you say.
The drinking, you
Gotta
can't just
stop.
cold turkey. You cannot just cold turkey. That's not okay with me. You're going to have to cut down 8 to 10 beers. While it's not a lot if you're doing that maybe 2 or 3 days a week, but every day you're gonna have to cut down.
Well, I'm all for that.
So what I want you to do is I want you to get to 3 beers a day. So I want you to cut down a beer every week.
Okay.
And that's it. This is gonna be a slow thing.
Yeah.
I don't want to put you. I'm trying to get it to where you're not going to wind up in a hospital because you are detoxing. Okay?
Okay.
So I want you to cut a beer a week.
Okay.
Yeah.
So on Monday, I want you to take it down to 9 beers. On Monday, or Sunday, whichever, I want you to take it down to 8 beers, 7 beers, 6 beers, 5 beers, 4 beers. So you have that whole week for your body to adjust to the one less beer.
Okay.
Make sense?
Mm-hmm.
Mom will take care of me.
That being said, you're going to have to replace that with something else because you have an addictive personality.
I do.
You have it in your genes. If you want to replace it with something that's better for you.
Water.
Yeah, but water's boring.
It is.
Don't
want to do Coke.
Don't do Coke. I don't want to give you diabetes. Do you shop at Walmart ever?
Mm-hmm.
So there's this stuff called vitamin water.
Oh, yeah.
And it's artificially sweetened, but it has erythritol in it. And erythritol is an alcohol sugar. That's not true alcohol. It won't get you drunk. It won't help with pain. But it tastes like sugar. And I love it. I have it in the car. My husband loves it. We both it's $1. It's $1 a piece for 16.
Yeah.
It's so good. Try that.
Okay.
You might like it. If you don't, we'll start with something else. Okay. But I've been in counseling before because I have a terrible mother. I'm going to be in counseling for the rest of my life with her. Not with her, but because of her. And my counselor said a great thing that I completely understood. Just because you like get rid of one habit, because I tend to be OCD, that's how mine manifests, my anxiety. I had to replace it with something else. So instead of freaking out about the dishes not being done right or the laundry not being done right, I had to replace it with something else. So that being said, what I'm saying is with you quitting drinking, you're going to have to replace it with something else.
Absolutely.
But you need to find something healthy to replace it with.
Absolutely.
So we need to work on that.
Okay.
I would love for you to try the Cymbalta. I can see how much it is. I want to put you on a muscle relaxer. Like, I want to so badly, but I am afraid to with the alcohol. Because you'll fall. Like, I'm not saying it's a matter of when. It's not if. It's a matter of when. You will fall.
Well, I figure if you're not falling, you're not trying.
It's go hard or go home.
There you go.
So when you are down to 5 beers a day, I'll write for the muscle relaxer.
You can do that today.
No.
Okay.
No.
Oh, we're
You're
replacing.
gonna detox. You will detox if you do that. 10 beers a day is a big deal. I don't want you to detox. Wrong. You're detox. So you can detox healthily and you can detox non-healthily. Non-healthily is cutting it out and ending up in the hospital. We need to detox healthily.
Okay.
One beer a week.
Rest.
Yes. Yes. I want to do blood work. I want to see where your kidneys and liver and all baseline so that I can start slowly adding medication back that will help you and see about physical therapy, occupational therapy, get your strength back and see what's going on. I need to figure out pricing so that y'all know the pricing for what I want to do. And let me see how much Cymbalta is. So it says to start you on 30. Let's see. Let's see what a 90-day is. Okay. Publix. So we can try a 30-day and because it's just cheaper generally.
Mm-hmm.
For a month, it's $11.24.
Oh.
That's
at Publix or?
At Publix
What is that?
or
Good
Walmart.
RX? Okay.
Yeah, it's Good
Yeah.
RX. I have.
Good RX is good.
Do you have Good RX?
Mm-hmm.
You know how to use it?
Mm-hmm.
Okay. So if you want to try that, I can send it to either one. It's a 10-cent difference between Publix and Walmart.
Yeah, I think in the record we usually use Walmart.
Okay.
And I put that in as info. So.
Yes.
How long does it take this to start?
So you should start seeing a difference in a week to 2 weeks and a peak in 4 to 6 weeks.
I don't think I'll live that long.
I think you will. But also note that in that 4 to 6 week range, if you get down to 5 beers, I can write a muscle relaxer for you too. So I'm going to start adding things.
Okay.
But I don't want to blindsidedly come in and say, I'm going to write all these things for you and I'll see you in a month or 2 months. Like, I want to see what your body's doing.
Okay.
I want to keep you alive. And I could kill you if I did that. The other way.
You don't want to do that?
No, don't want. No.
Not after this long.
I'm going to diagnose you with chronic pain syndrome. I think you do have chronic pain syndrome. With all the pain that you are enduring. Now, that being said, I think it's due to the stroke. So, let's try this.
So, who takes the blood?
I am going to text this woman named Bree and ask her to price it for me. And if it's too expensive, then we'll find another company.
Give me some Cymbalta.
I'm writing it, yeah. Walmart in Brainerd.
Yeah.
Cool.
The one where they had the shoot.
Oh my gosh, I know. Are you not close to the Walmart neighborhood pharmacy?
Oh, you mean the one on,
Shalford.
probably. We just always shop and go to that other one.
Okay.
Which I don't mind going to, so.
So the Paxil, it kept you up at night?
For 2 nights in a row.
Okay. So I'm gonna want you to take this in the morning. It's crazy. Some people, these medications, they make them drowsy, and some people it keeps them wired. So
Well, I'm right here, so it doesn't matter if it's drowsy.
okay, Bree said yes. So I'll get a list to her of the blood work I want to do,
Okay.
and I'll keep in touch with you on Clara,
Okay.
and we'll figure out the price that works for y'all. And I can tweak it. Like I don't have to have a whole panel of everything.
Yeah.
So I'm gonna get what I feel like is needed, and
Okay.
we'll talk about the price.
Okay.
30 capsules. So no refills right now. I want to see how you do on it.
So do I.
So I don't necessarily have to come back in a month unless y'all want me to. I can come back every 2 months. It's whatever y'all need, but I want you to check in with me and let me know how you're feeling.
Okay.
Did you ever have a colonoscopy?
No, ma'am.
Okay.
They keep bugging me for one, but I'd rather just die.
You don't want one? Do you wanna see me a couple more times and
Yeah, we'll worry about it.
yeah, we'll get to them when we
Just want to be able to sleep.
cross that bridge. You're not sleeping either.
Well, that's about 50 minutes and then I'll wake up.
Okay.
I don't know why.
It sounds silly, but have you tried melatonin?
Oh, yeah, that's what the other thing he takes.
I mix it with applesauce.
So melatonin, zinc, and
Potassium citrate.
yeah.
It's supposed to be good for
Magnesium. You need to get you some magnesium.
Well, we had that, all of magnesium, but it was giving me diarrhea.
Which type of? There are 2 different types of magnesium. Okay. I'll tell you which magnesium to get. Are those the meds? The medication.
The med, yeah, this is the magic.
Cool.
So those, and then the CBD.
What about those 2?
Tea tree oil.
Melatonin.
Oh, that's just an extra melatonin.
Oh, you're going to find a bunch of tea tree
You taken the antacids recently?
oils.
Probably been a while.
Just as needed.
Yeah, I'm not right now. I read where that's supposed to help with Christmas.
Yeah, if you're low on potassium, definitely can help. So you take 1 capsule daily.
Mm-hmm.
1 of zinc, 2 of melatonin.
And zinc is a great take. Love me some zinc. It's part of my daily regimen too. These are tablets, capsules.
And we put all that in applesauce because he has trouble swallowing any
Okay.
kind of pills.
Oh, we have a pill crusher.
Do they get stuck in your throat?
Do what?
Do they get stuck in your throat?
Sort of in the back of my throat. It was weird because I tried to take a melatonin and it got stuck there. And then once the capsule was dissolved enough, it exploded in the back of my head.
Oh,
That was terrible.
So take one day, one capsule. Got 'em.
So when you're done, if Becca goes to the pharmacy and gets that stuff, go ahead and take it.
Yes, of course.
Because this just hurts. You want me to stand up again?
No.
The odd thing was, when they did my liver kidney thing,
Yeah.
the girl receptionist calls and says, no Tylenol or alcohol for 30 days.
What?
And then I said, well, what am I supposed to do for pain? She said, well, take ibuprofen. Well, I understand if you're on blood thinners, ibuprofen increases your chances of a stroke 30%.
And regardless.
Oh, watch out. Oh.
Thanks.
Okay.
Regardless of that, so you should not. I would rather you take Tylenol than ibuprofen. Ibuprofen can cause a heart attack and stroke, and GI issues. I don't want you with a GI bleed too. But with you drinking, it's not good to do that either. But I would rather you take Tylenol. But I wouldn't do the extra strength. I would do the 325.
We do.
Perfect.
Okay.
Like me.
Have you ever been told you have high cholesterol?
Yes.
That was a trip. What was that last Linus super or something?
Do you know what medicine you were taking for your blood pressure?
Not okay.
Okay.
Wait, well, isn't that what warfarin is?
No, Coumadin or warfarin is the blood thinner.
Oh, okay. Same doctor. Goodness.
I didn't read it.
You're dead. Sorry.
Have you ever been told you have an irregular heart rhythm?
Oh man.
Don't need a urinalysis.
158/96.
It's a little bit better.
It's getting close. Well, they got all freaky, but apparently the American Heart Association revised values for somebody my age. It was completely within that range.
Yeah. It's with you having had a stroke, it's okay that it's a little bit higher because the pressure of the blood, since you have some what's called stenosis in your arteries, where plaque buildup, you need that a little bit higher pressure to get the blood flowing through the areas that are a little bit
That
thinner.
makes sense. Yeah.
That's why on the stroke floor, it was okay when a patient, his or her blood pressure was in the 200s right after the stroke.
Oh, because they had to work harder.
Because we wanted that, in fact, so you didn't stroke out again.
I hated those little bead things they had to wear.
I know. Oh, telemetry monitor. Okay. I'm almost done here. Let's see. Questions. I have more questions, and then I'll price the blood work and get back with you on that.
Okay.
Fever, night sweats,
I do get night sweats, but I haven't had any of those.
weight gain or loss significant?
No.
Obviously, exercise intolerance. Chills. I feel like you said you did have chills.
Well, I don't want to get chills because then my neck goes nuts. That's why I wear this. Here it is.
You're laying on it.
Hearing issues?
None.
Ear pain?
No.
Nosebleeds?
No.
Sinus problems?
No.
Sore throat?
Well, that's hard to say.
Yeah.
Because sometimes the nerves make it feel like I need 2 or 3 root canals or something. But then it goes away,
Yeah.
and then some other teeth start hurting.
Do you snore?
No.
Dry mouth?
I have that right now.
Are you nervous?
Well, yes.
When's the last time you saw a dentist?
Oh, I don't know. A long time ago.
Over 5 years?
Mm-hmm.
10?
Mm-hmm. It would have been Dr. Stansberry, right?
Or that other guy. Right there next to the creek.
Oh, did you go to him? We always go to him.
Yes, I did.
You're fine. Ringing in your ears?
Oh, no, no.
Okay.
Oh!
What are you trying to do?
Sit up.
Okay. Chest?
Oh!
What about chest pain?
Only from falls.
Falls.
I mean, ribs were bruised, kind of thing. Not heart attack, chest pain.
Any left arm pain on exertion?
No,
Shortness of breath when walking?
no,
Lying down?
no,
Heart palpitations where your heart feels like it's skipping a beat or fluttering?
no,
Ever been told you have a heart murmur?
no, ma'am.
Ankle swelling?
No, ma'am.
Cough, wheezing?
No, ma'am.
Shortness of breath?
No, ma'am.
Ever been told you have sleep apnea?
No, ma'am.
Any abdominal pain?
No.
Nausea, vomiting, diarrhea?
Diarrhea from that magnesium.
What about right now?
Well,
Okay. I will definitely note that for sure. I'm taking magnesium oil. Constipation?
no, ma'am.
How's your appetite?
Terrible because of pain.
Makes sense. Decreased appetite due to pain.
Dr. Hartline is the dentist.
Sure, y'all's memories are so good.
Yeah, well, it took me a while to get there.
Have you ever been told you have acid reflux or GERD?
Oh yeah, you had GERD.
Saw that with crowd.
Let's see. Okay. Chronic. Are you going to the bathroom again?
Probably.
Any incontinence? Urinating or pooping?
Not recently.
Okay.
At first I did just because the muscles were.
They were low. Any difficulty urinating?
Nobody told me you had to squeeze your butt when you cough. Any difficulty doing what?
Urinating.
No.
Any blood in your urine?
No.
Although sometimes you'll go to the bathroom but not go.
Yeah,
It feels like
a
he has to
guy
go, but he doesn't go.
Okay.
It's like when you're gonna blow your nose and nothing comes out. Call that dry blow. So dry piece.
Okay, so I'm gonna click muscle weakness, muscle aches, joint pain, back pain, neck pain, difficulty walking. You're having like crampy, like muscle spasms. Fractures? Have you broken anything?
Collarbone perhaps.
Not recently, not that we
Well, that
know
was
of.
Any skin changes like moles, rashes, lesions?
Dry skin. Way dry skin.
But the areas that you've like hurt are healing.
Yeah.
I'm a good healer.
Good. Okay, we're almost done. Any loss of consciousness?
No.
No.
Don't think so. No.
Weakness,
No.
numbness in the right arm?
Did I ever have numbness in my right arm?
What about now?
No.
Okay.
Oh,
So
but
you've gotten the feeling back from your stroke?
what feeling? Which feeling?
So
I still don't.
typically speaking, I'm assuming after you have a stroke, depending upon what side it affects more, you lose a little bit of feeling in that side. That's
Well,
what I'm talking about.
I can tell you that my right arm felt like it weighed about 500 pounds.
Yes. That's what I'm getting at.
No, it's not there now.
Okay. So no numbness.
Not really.
Any history of seizures?
No, ma'am.
Dizziness right now?
No.
Headaches?
Just from this stuff.
Okay. Frequent headaches?
All the time headache.
You said restless leg. We have a little bit of a weakness tremor. You are not paralyzed. Sleep disturbances. Restless sleep is what you said. Anxiety.
I think because at Erlanger they kept getting you up every 2 hours.
Oh yeah, they do. Any suicidal thoughts? Have you been there? Have you reached that Are you there now?
No, I'm way past that.
Okay.
Does frequently ask me to kill him.
I ask that sometimes too.
It's been a few times I've been tempted. But I haven't.
No.
But I haven't.
Any memory loss or dementia that you've noticed? Okay.
No, man.
Is that your diarrhea?
Well, it's weird because it sounds like diarrhea. Oh, the gate's open and little poops come out. So that's what you're hearing, the poops.
Little bitty ones.
Well, you can look, well.
Any increased thirst?
Well, yes.
So you said no anemia. Excessive bleeding? I know you're not on blood thinner.
No, you know, the times he's cut himself and stuff, it isn't excessive, so. Like
Easy
the,
bruising though.
yeah. I wouldn't say easy.
No.
No, not
Okay.
really easy bruising.
Okay.
Because I would have thought when he fell, the bruises would have been much worse, and it seemed like it took a while for them to develop. And then they weren't even that bad.
Okay.
You see the leftovers from the rug burns.
But that's old.
Well, that was right before Thanksgiving, so but they
2 months ago.
scabbed up and healed pretty well, all things considered.
Okay. Looked like they were comprehensive general dog exam. Perfect. Okay. So when you get done, I'm gonna look in, check your eyes, and then I'll get going.
You're gonna do what?
Check your eyes.
Check my eyes.
Yes. Okay.
Are you gonna want to see this poop and stuff?
No, as long as it doesn't have blood in it, then I'm good.
That's how I am.
I have an hemorrhoid about the size of Texas.
That sounds fun.
You've always had that problem now.
I think all people who express themselves.
Sure, that plant.
It was funny, I went to a doctor. I was supposed to evaluate whether I was disabled for Social Security or not. Apparently I'm not disabled.
What?
But he'd say, okay, stand on one foot, both eyes closed. I said, I can't. Both eyes closed. I can't do that. Both eyes closed. I can't do that.
Yeah, they did deem you not disabled. I don't know. Didn't fit the criteria.
Where did you go?
I'm ambulatory.
Well, one was the Social Security, administration. Yeah, well, they sent us to their doctors.
I had to go to a psychiatrist.
Because you weren't blind or something else.
I was ambulatory. I could move. It didn't matter if I could do anything. Do you want me to sit up to check?
Okay. Yeah, I want you to start magnesium citrate, which is a little different.
Okay.
So you can start taking that. Good. Right, Gus.
You gotta look in there.
Yeah, I do. Good.
I can't hardly brush my teeth. Have some of that.
Okay, so start Cymbalta. I'm sending that.
Cymbalta, cut back on beer and use magnesium citrate. Drink bottled water.
So, let me see.
Yeah, I also have that in water infused tea bag things. Have you tried that?
No,
That's something new. Hold on. I thought it was pretty good.
Can I lay down again?
Yes.
I just got this not too long ago.
That's cool.
Yeah,
Oh, I like
Walmart.
tomatoes.
And I
That's
just
cool.
kind of made your water.
Smells
I
good.
liked it. So
Okay, I'm gonna send you a message. So we've requested the records from the different places we talked to you about. And then I'm gonna send y'all a message. By magnesium citrate.
You have Becca's email, right?
Do what?
Which email are you sending it?
I'm sending it to the Clara messaging system that we have.
Oh.
it's not on your phone, it's on my phone.
Because I don't ever look at that.
You don't have a smartphone. So.
I think I have a smartphone.
You got it. So
Okay.
I send that to you.
Hope that stuff starts as soon as possible.
Oh, and Vitamin Water's here. I would just try it. You might like it. They have different ones.
I know I was drinking tonic water because it had the quinine in it, which was
Strawberry lemonade. There's fresh squeezed lemonade, and then there's one that's like blueberry lavender. Looks pretty good. You got it?
So I'm logging in. There we go.